Good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. Today, all of our speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thank you very much, and good afternoon, everyone. Our press release today noted that Monday brought the 5-month anniversary of the first positive COVID case in Philadelphia. Now, that may be somewhat of an arbitrary milestone, but still I want to take a moment to reflect on it. I am proud of the resilience the Philadelphians have shown since early March, when the first case was confirmed. By masking up, by observing social distancing guidelines, and by supporting your neighbors and your first responders, the residents of this city have made a huge difference. Case counts are dropping, and our hospitals, at least at the moment, have not faced surges that could have overwhelmed staff and made treatment all the more difficult. That progress is not meant to discount the pain and grief that COVID-19 has brought to so many Philadelphians and their families. 30,000 residents have battled this virus and 1,700 have succumbed to it. For those who survived COVID and for the relatives of those we've lost, these 5 months have been a trial unlike any other. I hope that you have had and continue to get the support that you need. Of course, we have far to go. When we received confirmation of the first positive case on March 1st, I had hoped that we would be through this by late summer. Instead, as you all well know, cases are still prevalent in other parts of the country, and many Americans seem intent on willfully ignoring the very simple things that can help end this pandemic. I hope and pray that in another 5 months, this country will be out of the woods. I wish I could say I'm optimistic. For now, though, I can tell you that I choose to be hopeful. I choose to believe that our spirit and our resilience will prevail over the challenges this nation faces. I hope all of you believe that as well. Now it's more important than ever to stand strong together. COVID-19 can affect anyone. We have witnessed its effects on Philadelphia and our communities. The virus has virtually changed our lives. And just yesterday, we also witnessed how Asian communities, and specifically China, were blamed again by the president for the virus. Unfairly blaming Asian individuals and communities in times of crisis is not new and is unfortunately not uncommon. The fact that derogatory rhetoric comes from the White House makes it all the more abhorrent, and this must stop. Again, I want to remind you that acts of hate and discrimination against anyone based on their race, ethnicity, or other characteristics will not be tolerated in our city. There is no place for hate in this city of brotherly love and sisterly affection. Philadelphia is a diverse city that is made up of people from all backgrounds. We urge all Philadelphians to seek a sense of shared humanity, question your own fears, and treat your neighbors with compassion and understanding. And now Dr. Farley with his update.
Thank you very much.
Farley, you need to unmute yourself.
All right, let me start over. Overall, I can report good news over the short term and progress over the long term. Our case counts are falling in Philadelphia and around us, and our severe outcomes are following over the long term. Here are the numbers. Since this time yesterday, we've identified 145 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 31,584 since the beginning of the epidemic. Now, for the past week that ended last Saturday, August 8th, we averaged about 105 cases per day. So that 145 is a little higher than that, but it fluctuates a lot day to day. Our oral numbers are down. At 105 cases per day is compared to 123 cases per day the week before that, and 166 cases per day the week before that. Now, our new cases are still predominantly younger people. 59% of the cases reported today are under the age of 40. And we have no evidence of a delayed increase in the number of cases in older people after the increase in our total case counts we saw in late July. Now, also last week, we averaged 4.1% of the people who were tested for this infection being positive. That 4.1% positive is the lowest percent positivity we've seen yet. It was 4.8% the week before that, and that was the first time we had ever been below 5%. Now, we've been reporting these case counts for the last 5 months. As the mayor said, the first case was reported in Philadelphia on March 10th. Since then, at these press conferences, I've mainly focused on the number of cases that we see each day, and that is important. But remember that most infections cause either no symptoms or mild symptoms. So what matters most are the severe outcomes. such as infections in people in nursing homes, hospitalizations, and deaths. Our website shows data on the severe outcomes. And as of a couple of days ago, we have an option where you can show the numbers by week, which give you a better sense of the overall progress we've made over the last 5 months. So for example, if you look at the number of people admitted to hospitals, newly admitted per week, it was more than 800 at the peak in mid-April. In late July, it was less than 100. As far as nursing home cases, in the last week, we had only 4 cases, many of which were identified through screening of asymptomatic residents. That's down from 750 cases at the peak week in April. Now on to deaths. We have 1 additional death to report today, bringing us to the total of 1,700 deaths since the beginning of the epidemic. But to put that in perspective, at the peak week in mid-April, we had 250 deaths in a single week. In the last week of July, starting July 26th, we had 8 deaths. So far in August, we've only identified 2 deaths. Now, typically there's a delay in hearing about some deaths, so we'll learn about some later. But the fact we're talking about 1 or 2 over an entire week is a sign of how far we have come. No death is acceptable, but we're getting down to 0. That's a very big sign of progress. Now, where are we with testing? We still have long delays in people getting their test results reported to them from some laboratories, particularly a laboratory called Quest. It does about 12% of the testing in the city of Philadelphia. We have seen improvement in delays in turnaround from other laboratories, particularly another big laboratory, Lab Corporation, was averaging about a 7-day turnaround. Now they're averaging about a 2-day turnaround. So that's progress. Contact tracing is still going on. We have a large team that's doing this work. I'm going to give an update on Thursday of the data from contact tracing for last week when our numbers are more complete, because it takes a few days for the work to play out after we initially hear about a case. That's what's happening in Philadelphia. Around the rest of the region and the state of Pennsylvania, case counts are also falling over the past 2 weeks. And in the United States as a whole, case counts are quite high, nearly 50,000 cases per day in the nation as a whole, but they are declining, falling about 18% over the past 2 weeks, according to data compiled by the New York Times. So I can't say how long this will last, but as of today, all the trends of this are in the right direction. All the trends are good. Which then brings me to how we maintain that. The most important thing people should take from this is we need to continue to wear masks. It's more important now than ever. We want to maintain this momentum. We don't want to go backward. So if there's one thing that people should do, it's commit to wearing a mask when you're around others. It's especially important as we approach the reopening of colleges and universities and the reopening in class of some schools. It's important for students. It's important for teachers in those colleges and in those schools, and it's important for everybody else. Finally, let me just remind people that there really is an extra risk for people who are medically vulnerable to this infection. That would be people over the age of 65 or people who have chronic medical conditions. It's best for people in those categories to stay home. Avoid contact without masks, even with your relatives and caregivers who are out and about. If they're out, they might very well be carrying this infection and not know it. So if you're around your relatives and caregivers, make sure they're wearing a mask and you're wearing a mask. We will be trying to identify as many people as possible and get the right messages to them who have these medical conditions and are living at home. So as of this week, we'll be sending a postcard to some 14,000 people who we believe are high-risk residents in Philadelphia with the information that they should stay home and phone numbers about support that they may need in order to do that. So that's the update for today. If you want more information, just go to our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. We are now going to turn it over to Armando, who will deliver the Spanish language translation of both the mayor and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney para el martes 11 de agosto del 2020. Buenas tardes. Nuestro comunicado de prensa de ayer señaló que el lunes se cumplió el 5º mes tras haber anunciado el primer caso positivo de COVID en Filadelfia. Puede ser un hito arbitrario, pero aún así quiero reflexionar un momento al respecto. Me enorgullece la resistencia que los habitantes de Filadelfia han demostrado desde principios de marzo, cuando se confirmó el primer caso. Al usar las mascarillas fuera de casa, observar las pautas de distanciamiento social y apoyar a sus vecinos y a los socorristas, los residentes de esta ciudad han marcado una gran diferencia. El número de casos está disminuyendo en nuestros hospitales, al menos por el momento. y no hemos tenido aumentos repentinos de casos que podrían haber abrumado al personal y dificultar aún más el tratamiento. Este avance no implica, sin embargo, descontar el dolor que el COVID-19 les ha traído a tantos habitantes en Filadelfia. 30.000 residentes han luchado contra este virus, que se ha llevado 1.700 personas. Para los que sobrevivieron al COVID y para los familiares de las personas que perdimos, estos 5 meses han sido una prueba como ninguna otra. Espero que hayan tenido y que continúen recibiendo el apoyo que necesitan. Por supuesto, tenemos aún mucho por hacer. Cuando recibimos la confirmación de ese primer caso positivo en marzo, no esperaba que todo esto hubiese terminado para fines del verano. En cambio, como todos sabemos, los casos todavía prevalecen en otras partes del país y muchas personas parecen decididas a ignorar deliberadamente acciones tan sencillas para ayudarle a dar fin a esta pandemia. Espero y rezo para que en los próximos 5 meses este país esté fuera de peligro. Ojalá pudiera decir que soy optimista. Por ahora, sin embargo, puedo decirles que estoy escogiendo tener esperanza. Elijo creer que nuestro espíritu y nuestra resistencia prevalecerán sobre los desafíos que enfrenta esta nación. Espero que todos ustedes también crean en esto. Ahora es más importante que nunca permanecer unidos. El COVID-19 puede afectar a cualquier persona. Hemos sido testigos de sus efectos en Filadelfia y en nuestras comunidades. El virus cambió todas nuestras vidas. Ayer mismo también fuimos testigos de cómo el presidente culpó nuevamente del virus a las comunidades asiáticas, específicamente a China. Culpar injustamente a las personas y comunidades asiáticas en tiempos de crisis no es algo nuevo y lamentablemente es una práctica común del presidente Trump y de su administración. El hecho de que la retórica despectiva provenga de la Casa Blanca lo hace aún más aborrecible y esto debe terminar. Una vez más, quiero recordarles que en Filadelfia no se tolerarán los actos de odio y discriminación contra cualquier persona por motivos de raza, etnia u otras características. No hay lugar para el odio en la ciudad del amor fraternal y el afecto sororal. Filadelfia es una ciudad diversa que está formada por personas de múltiples orígenes. Instamos a todos los habitantes de Filadelfia a ser más humanos, a enfrentar sus propios temores y a tratar a sus vecinos con compasión y comprensión. Y esta es la actualización en materia de salud para el día martes 11 de agosto del 2020. Comenzamos con buenas noticias. Ha habido un gran avance. El conteo de casos está disminuyendo en Filadelfia y en nuestro alrededor. El día de hoy reportamos 145 nuevos casos, con un total de 31.584 casos acumulados. La semana pasada, que terminó el 8 de agosto, el promedio fue de 105 casos diarios. Esto es una disminución si lo comparamos con que la semana anterior el promedio de casos fue de 123. Los nuevos casos reportados se dan en poblaciones predominantemente jóvenes, el 37% entre los menores de 30 años y el 59% entre los menores de 40 años. No hay evidencia de un aumento de casos entre las personas mayores. En promedio, un 4,1% de las pruebas realizadas ha dado resultados positivos. Este es el porcentaje de positividad más bajo que hemos registrado en una semana. La semana pasada el porcentaje fue de 4,8%. Hace 5 meses reportábamos el primer caso y esto fue el día 10 de marzo. Desde ese momento hemos hablado mucho sobre el número de casos. Sin embargo, muchos casos no presentaron síntomas o presentaron muy pocos síntomas. Una de las estadísticas más importantes fueron las infecciones en hogares de ancianos, las hospitalizaciones y las muertes. Estas estadísticas pueden ser vistas en nuestro sitio web. Al verlas y estudiarlas, podemos tener un mejor sentido del avance que hemos logrado. De las personas ingresadas en los hospitales, pasamos a más de 800 pacientes semanalmente en abril a menos de 100 pacientes por semana a finales de julio. Sobre los casos en los hogares de ancianos, reportamos 4 casos la semana pasada, pero muchísimos menos que los 750 en el punto más alto de la pandemia. Y no hay síntomas de aumento desde julio. Hoy, tristemente, reportamos un nuevo fallecimiento por el COVID-19 en la ciudad. El total acumulado de muertes por el COVID-19 al día de hoy es de 1.700. El punto más alto de nuestro informe fue de 250 casos la semana del 12 de abril. 8 muertes a la semana del 26 de julio. Para agosto y hasta ahora solamente hemos reportado 2 muertes. En general, hay un retraso en el reporte de los fallecimientos y ciertamente nos enteraremos de más muertes en el transcurso de la semana. Pero esto es una señal de cuán lejos hemos llegado en nuestra contención del virus. Respecto a las pruebas, continúan aún los retrasos para algunos laboratorios, particularmente el Quest. Pero tenemos que reconocer que el laboratorio LabCorp ha mejorado sus tiempos de respuesta, pasando de 7 días a 2 días para entregar resultados. Respecto al rastreo de contactos, tenemos un equipo grande que está haciendo este trabajo. Para el día jueves proporcionaremos una actualización completa sobre su actividad. En la región, los casos continúan disminuyendo y estamos vigilando esto con mucha cautela. En cuanto a la evolución de la pandemia en los Estados Unidos, vemos que se ha llegado a un punto de declive. El recuento de los y de algunas escuelas. El COVID-19 aún representa un riesgo para las poblaciones vulnerables. El virus se encuentra circulando en Filadelfia y no es seguro exponerse si es usted mayor de 65 años o tiene condiciones médicas crónicas o es una persona de alto riesgo. Por favor, quédese en casa. Evite el contacto con familiares o personas fuera de su núcleo familiar. Tanto usted como ellos deben usar una mascarilla cuando estén cerca. Estamos enviándoles una postal a 14,000 residentes de alto riesgo en Filadelfia que contiene esta información y números de teléfono para que la gente llame si necesita ayuda. Con el esfuerzo de todos estamos ganando la lucha contra este virus. Sigámoslo haciéndolo. Muchas gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the media, and we will start with questions on topics related to the COVID-19 pandemic. So if your hand is raised for another topic now, you can lower that and we will try to get to that later. I also want to note that today we are joined by Deputy Managing Director for Criminal Justice and Public Safety, Vanessa Garrett Harley. So if you have any questions, please address them to the appropriate person. And also, please remember, we do have limited time during these briefings, so only one representative from each outlet is permitted to ask questions, and reporters are asked to limit their questions to 3 or fewer. We will do a second round of questions if time permits. So for those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your question if you are able, and we will now unmute reporters one by one, starting with Mitch Blocker of NBC 10. Mitch.
Good afternoon. Dr. Farley, I have a couple of questions for you about your meeting with Dr. Birx's task force. I'm curious what you expect from the meeting as it goes on this afternoon and tomorrow and Thursday.
So background for other people, there is a group of federal workers who are from Health and Human Services who are here doing a site visit. They've been doing site visits for cities around the country, and Philadelphia is one that they've requested. They'll be here today, tomorrow, and Thursday. This is really an opportunity for them to see our prevention work. And so we are talking to them about all the different aspects of our work, from testing to contact tracing to social distancing to protecting vulnerable populations. It's an opportunity for us also to tell them what the federal government can do for us that could be helpful. We've spoken to them about the need to solve the testing problem. That these long delays are really very problematic for us. And we talked about the need for really thoughtful planning right now about how we deploy a vaccine when it comes around. So this is really more of a conversation between different levels of government about how we jointly do things better.
Is there advice that you plan to give them about what has been successful in Philadelphia, and also what exactly have they said when you've addressed the testing inadequacy?
They recognize it's a problem, that they will take that information back. These are not people who can solve that problem, but they can at least deliver that message to other people in the federal government. I'm sorry, the first half of the question was?
Oh, I guess I'm curious what lessons your team has learned that you think other American cities might benefit from.
I think they might have a better perspective on that than us. I know what we're doing, and I'm pleased with the effort we put in place here, but I haven't compared. I don't know too much about the details about what other cities are doing to know how we compare to other cities. and maybe they can provide some of that information to us.
Well, the question I'm asking is, what advice would you give to the task force to communicate to other cities that might be helpful?
Again, because I don't know where the other cities are, the main advice we're giving to the task force is what the federal government can do. These are people who understand how the federal government works. They're not necessarily local public health experts, and there are different approaches. And so I mainly want to take this as an opportunity to emphasize what the federal government can do to help. I do think, testing has been a problem since the beginning of this thing 5 months ago. It's not good that we're 5 months in and we still have that problem. And so I really want them to solve that.
Thank you, sir.
Thanks, Mitch. We're going to go now to Iris Delgado with Telemundo. Iris, you just have to unmute yourself there.
Still muted. Okay, here we go.
There. Hello.
Oh.
Yep.
Excelente. Mi pregunta es, ¿quiénes son estos 14,000 residentes vulnerables y cómo fueron identificados? ¿Quiénes son ellos en cuanto a su raza, su edad y cómo fueron identificados?
My question is in regards to 14,000 vulnerable residents that will be contacted by sending them the postcard. I would like to know how they were identified, whether they're identified by race or age.
So the federal government, through the Medicare program, has information about what residents of Philadelphia are receiving payment for durable medical equipment. That could be home oxygen. It could be other supplies that someone who has a chronic medical condition needs at home. That is not a perfect marker, but a pretty good marker that these people have chronic medical conditions. So we have their address. We don't have anything else that I'm aware of beyond that. So they were not chosen by age or race. They were just chosen by their medical vulnerability. Now, by virtue of the fact that this was Medicare, most of those people are going to be over the age of 65, but that's how they were identified.
El gobierno federal tiene un listado de los recipientes del programa de Medicare y esa es la información que hemos utilizado para poder identificar a los residentes de Filadelfia. Obviamente, estos residentes reciben un pago para poder proporcionarse equipos y suministros para controlar sus condiciones médicas crónicas y este es el marcador que hemos utilizado nosotros. Esta lista nos proporciona a nosotros su dirección. No se les ha escogido por raza, pero entendiendo de que este es un programa para gente mayor, ellos son todas personas por encima de los 65 años de edad y es un inicio. Gracias.
¿Cuál exactamente es la indicación para estas personas? Ellos van a recibir esta carta, asumo, en los próximos días. ¿Qué va a decir? ¿Qué se les está pidiendo? Y tengo una tercera y última pregunta.
Yeah, I have a third question, but the second question is what's exactly contained in this postcard sending to these people and what are they being told in it?
They're being told the same information I just gave here, that they, if they're over the age of 65 or they have a chronic medical condition, they should stay home so they can stay safe. The people around them should wear a mask. And then there's phone numbers that they can call and websites that people can get more information.
La misma información que les he proporcionado de que si son mayores de 65 años que utilicen la mascarilla y tengan cuidado con su posición, que permanezcan en casa para mantenerse seguros utilizando la mascarilla.
Última pregunta, se anticipaba que con la pandemia se hubiese visto una reducción en la cantidad de crímenes y violencia en Filadelfia, pero al contrario, hemos visto todo lo contrario. Y esta mañana ya la policía se expresó sobre cómo la pandemia lo ha impactado de manera monetaria y falta de recursos, ¿no? ¿Qué tiene planificado hacer la ciudad para solucionar este problema?
We were anticipating that because of the pandemic, crime and violence in the city would come down, but it's been quite the opposite. Crime and violence are up, and the police has spoken this morning about their impact that they've had in terms of their finances and the lack of resources. What is the response of the city to this crisis of violence and crime in Philadelphia?
Well, part of the problem was that our strategies to curb violence in the city and crime actually, other than the shootings and obviously the homicides, which are two important things, is down. But we've had difficulty interfacing with our community representatives, people going out, again, to interface with folks who are more likely to be shot or be shooters and interact with their families and with their other associates to drive down this propensity to take out your frustrations and your grudges and other things with a gun. That is, the pandemic has slowed us down. As we begin to emerge from this, we're bolstering our efforts to get out into the community and to interface, interact with these young people. Also taking other measures to make sure that those people who are locked up for gun charges stay locked up, especially if it's their second or third offense. And we're trying to work with the DA's office and the courts to make sure that happens. And Vanessa, you can add some other things if you'd like relative to GVI, CCIP, and Pinpoint.
Good afternoon. So we have undertaken, as part of the Philadelphia Roadmap to Safer Communities, which is the city's plan to address gun violence in the city. As the mayor has said, we have had some setbacks because primarily violence prevention programs are very difficult to do and be cognizant of the social distancing that this pandemic has thrust upon us. However, we still have programs that are undergoing. We just launched about a week to 2 weeks ago, group violence intervention, which we call GVI. And even that had to be done differently than we would normally do it because of the pandemic. But we launched it doing custom notifications, and that is trying to focus on that very small percentage of the population that we believe to be driving the shootings in the city, the bulk of the shootings in the city. And that is a collaborative effort between the community, the social services, and the law enforcement, which includes police, district attorneys, federal and state partners, and others. So that has just launched, and we are optimistic that that will help over time to begin to decrease some of the shootings in the city. We also have what we call our Community Crisis Intervention Program, or CCIP. I call them boots on the ground. Those are the folks who are actually going into the community. It is a part of that credible messenger model where many of them have credibility, and some of that is the result of their lived experience. And they go out and try to de-escalate tensions before they turn into a shooting, and also try to head off some of the retaliatory shootings that we've seen. So we're continuing to work in that regard.
The other thing I want to mention is that the police department's working extremely hard under difficult situations, taking record numbers of guns off the street. I think the last estimate, the last numbers I saw or heard were 70 or so a month over the past 4 or 5 months. We've been taking record numbers off the street. They've been replaced almost automatically because of the lax gun laws in Pennsylvania, and because the federal government doesn't have as much concern about dealing with gun trafficking. And we're going to continue, and that's on the Washington level. On the local level, we need to continue to work with the FBI, ATF, and the Justice Department, in the DOJ in Philly, to get the flow of these guns and the source of these guns, locked down. You look at a city like New York that's experiencing less of a homicide situation than we are. They have some of the strictest, state of New York has some of the strictest gun laws, not the most strict gun laws in the country. So strict gun laws statewide do have an effect, and shutting down the flow of guns into the city with help of our federal partners at ATF and the Department of Justice would also go a long way in reducing these numbers.
Thank you very much.
Es una respuesta larga, pero vamos a tratar de proporcionarla. Parte del problema para nuestra estrategia para tratar de disminuir la violencia, los homicidios y los tiroteos es la dificultad que hemos tenido en la comunidad para poder acceder a ellos. Estamos tratando de ver a las personas que pudieran ser víctimas de estos tiroteos y las personas que los puedan iniciar, para tratar de bajar la propensidad de resolver sus conflictos con la frustración y las rencillas que puedan tener, pero el efecto de la pandemia nos ha hecho esto más difícil, poder ir a la comunidad y acercarnos a las personas más jóvenes. También nosotros hemos visto que la gente que esté encerrada por tener delitos de armas permanezca encerrada, porque son terceras o terceras ofensas, y hemos trabajado en ello con la oficina de la Fiscalía para poder lograrlo. Vanessa nos agrega que también hay un buen entendimiento de nuestra parte del mapa de ruta que tenemos que seguir para hacer nuestras comunidades más seguras, pero ha habido también obstáculos y dificultades en el programa de prevención debido a las necesidades de mantener el distanciamiento social en la comunidad y, por supuesto, llegar a los grandes grupos. Tenemos un programa que es el GBI para tratar de marcar una diferencia y tratamos de tomar bajo custodia a las personas que pudieran haber hecho estos asesinatos o estos disparos, y hay un número pequeño de personas que impulsan la mayoría de estos incidentes. Tenemos también el involucramiento de las comunidades y los sociales y servicios sociales, incluyendo la policía y todos los que nos interesa bajar el número de violencia y de estos tiroteos injustificados. Tenemos un programa que es el CCPI, que es un programa de intervención comunitaria, en el cual tenemos mensajeros que van hacia las comunidades donde se dan estos incidentes, que tienen alta credibilidad justamente por su experiencia de vida en esta situación para poder tratar de desescalar las tensiones y lograr un resultado menor. Tenemos también a los departamentos de policía que han estado trabajando, y esto nos dice el alcalde Kenney, para tratar de retirar la cantidad de armas injustificadas de las calles. Ha habido grandes resultados en los últimos 4 o 5 meses, se ha reemplazado y hay una necesidad de tratar de hacer más estrictas las leyes tan flojas que tenemos que permite el tráfico de armas en nuestro estado. Esto con la ayuda del gobierno federal, que no está ayudando mucho para poder hacer una reducción del tráfico de armas ilegal en nuestras comunidades. A nivel local, lo que estamos haciendo para retirar estas armas de las calles involucra la participación del FBI, el Departamento de Justicia, el Departamento de Policía de Filadelfia y la asociación que controla las armas de fuego para tratar de reducir el flujo de estas armas y la fuente de estas armas en nuestras comunidades. Nueva York ha visto una reducción de menos de 100 tiroteos porque tiene una de las de las leyes más estrictas en cuanto a la restricción de las armas libremente en la comunidad. Por lo tanto, esperamos que la suma de estos esfuerzos nos dé mejores resultados a pesar de la pandemia. Gracias.
Thank you, Armando. Sean Walsh of the Inquirer is up next.
Can you hear me now?
Yep.
Thanks very much. I had a question for the mayor. With the gridlock in DC holding up a new stimulus act or like a new version of the CARES Act, we wanted to know to what extent the city is counting on another stimulus deal to provide additional funding. How much would it hamper the city if that doesn't come?
Well, obviously, if people who are unemployed are not getting any types of benefits from the federal government, that's a continuing exacerbation of the problem that we have already. The big thing we need is freedom to spend any additional CARES money for revenue replacement, which has so far been constricted or restricted. And that's where our big hole is. So if we can get some flexibility on whatever money comes from the federal government in the future, that'll help us get back to hopefully where we were in an upward direction from an economic standpoint. But obviously, if they're not going to do anything, it's going to get worse, not only in Philadelphia, but around the country.
Are you optimistic that that might happen?
I'm optimistic there are more sensible people in the House and Senate than are in the White House that will get it done.
Okay, thanks very much.
Thanks, Sean. We're going to go to Roberto Vinces from WFMZ TV.
Hi, good afternoon. Buenas tardes. Armando, quisiera hacerle una pregunta al alcalde y es en cuestión sobre la Liga Pública de Filadelfia y los deportes para los estudiantes. Si el alcalde tiene algún mensaje a los estudiantes que van a perder, posiblemente van a perder, ayer le anunciaron que van a suspender, pero hay una posibilidad que puede volver, pero si el alcalde tiene un mensaje a los estudiantes que no van a jugar deportes en el otoño, y si es así, si la ciudad va a planear programas o algo para los estudiantes durante ese tiempo.
Gracias. La pregunta es para el alcalde, ¿verdad? The question is for Mayor. Mayor, this is in regards to the public leagues for sports and students in them. The students have been told that games have been suspended and that they might come back later on depending on the situation. But for now, is the city contemplating having additional activities for them? What would be your message to the students? Will they have any support to play their games in the fall?
In the fall, probably we're not going to have competitive sports in the fall in Philadelphia and many other locations around the country. As you've seen, major college football conferences have announced that they're not going to be playing. The most important thing is that we follow the medicine and the science, and anything else comes secondary and tertiary to that. And as long as our health commissioner and health department are saying that we cannot conduct or allow these activities to be conducted, they're not going to be conducted. We will do our best to continue to try to provide additional things for our kids to do in our rec centers and in our athletic fields. As Dr. Farley has said many times, you're allowed to practice. You're allowed to, as long as you can somewhat distance. Obviously, baseball is different than football and basketball when it comes to interaction. The key is not to be able to have droplets of vapor coming out of people's mouths and lungs into other people's mouths and lungs. And as long as the activity eliminates the possibility of that happening, it's fine. If it doesn't, then it's going to have to be shut down until we get to a point where we can safely open.
La respuesta quiere decir que para el otoño es muy poco probable que los deportes competitivos puedan seguir reuniéndose para practicar estos deportes. Tanto en Filadelfia como en el resto del país hay restricciones. Hemos visto que las ligas del fútbol han suspendido sus actividades en ese sentido. Nosotros vamos a observar lo que nos dice la medicina y nos indique la ciencia. Todo lo demás son consideraciones secundarias y terciarias. Vamos a seguir las pautas que nos dicte nuestro comisionado de la salud y el departamento de la salud. Y si ellos dicen que no se puede, pues no se puede. Sin embargo, nosotros seguimos pensando que podemos proporcionar actividades adicionales a través de nuestros centros de recreación y en los sitios donde se practican los deportes y el atletismo. Y obviamente hay ciertos deportes que pueden practicarse manteniendo la distancia social. No es lo mismo hablar del béisbol que hablar del fútbol o el básquetbol, donde hay mucho mayor contacto, porque de eso se trata, de que las gotas del vapor y del aliento de los seres humanos no vayan de sus bocas y pulmones hacia las bocas y pulmones de otras personas. Entonces, las actividades que sean seguras las vamos a seguir enfatizando, como el deporte al aire libre, los deportes que no impliquen un contacto cercano y que se hagan en campos abiertos por el momento. Muchas gracias.
Muchas gracias.
Thank you.
Next, we have Jen Coleman with KYW. Jen, you just need to unmute there.
Okay, I think it worked. Can you hear me now?
Yep.
Yes.
Okay, sorry about that. Hi, this question is for Dr. Farley. Dr. Farley, on social media, the actress Alyssa Milano has said that her hair is falling out as a result of having COVID. And apparently there's some other people that are complaining of a similar symptom. She says that she had the long haul type, disease. Is that a possible side effect of having COVID? Does that seem unreasonable? Is it likely? And maybe just talk a little bit about these long haulers and the other symptoms that might come along with it.
I have not heard of hair falling out as being a symptom of COVID. I would think it would be unlikely, but this is a new virus. We're always learning things from it, and so I can't say it's impossible. I'm not quite sure what you say by long haul, but certainly some people have a prolonged course. Some people can be in a hospital on a ventilator for a long time. If you're sick for a long time, in general, that's going to make you weaker, more debilitated. You're going to lose weight and be weak as a result of that. And there may be a lot of complications from that. And could hair falling out be part of that? Perhaps. Again, I think that the key message is that this is still a new virus. We're still learning from it. But the most severe outcomes, I think we know about.
Okay, great. Thank you very much.
Jen, we're going to go to Martin Pratt of phila.gov.
Thank you. Dr. Farley, there was an article today at the Washington Post that talked about the net gatherers versus N95 mask or even the surgical type of mask. Can you explain why the net gatherers aren't really, actually the quote was, net gatherers are worse than no mask at all?
I think that's pronounced gators, but I did not see the article. I have not seen any research on this. So, what a gator is a piece of cloth that goes around your neck, and then you can use it to cover your nose and mouth. I would think that anything that's a cloth mask that's covering your nose and mouth should be helpful. In general, the tighter the weave, the more protective they are, because then more of the droplets are going to be filtered out. So if you are wearing a gaiter that has a very loose weave, and maybe some of them are, then it wouldn't be terribly helpful. But still, anything is going to be better than nothing. I think it'd be better for people to wear a mask, but I still, the most important thing is just wear a mask that you're going to be comfortable wearing.
One of the things that was talked about in the article was that the porousness that you spoke about, the droplets actually get through the mask a lot easier than any other mask they tested. And so there was also something quoted in there about 3-layer masks. And the reason why we're talking about this is because these masks become expensive. And so we're just trying to figure out exactly for Philadelphians that may be experiencing financial insecurity, what's the best option when covering their face?
Yeah. So we'll tell you what, the short answer is let us research a little bit about mask, sort of quality of materials and sort of get back to you in a future one. But if people are asking what mask I wear and what mask I recommend, is this one here, which I bought at pharmacy. It was $8 for a pack of 10. And, I can wear this for a week and it's still in pretty good shape. This is, it's a paper mask with multiple ply. We know that filters out an awful lot of viral particles. And so, there is some cost to this, but it's not a huge cost.
Thank you.
Thanks, Martin. We're going to go to Jack Tomsick now of Metro.
Yes, this is for Mayor Kenney. I think early in the pandemic, when there was an uptick of crime, you said that some of these people who were carrying guns illegally are being arrested and, kind of a revolving door and they're committing further crimes. Is that still a problem that you're seeing?
Well, we're doing a lot of research and drilling down into the numbers relative to the type of bail that's asked for, the type of bail that's given, whether or not there's bail given. And we're more concerned, or the most concerned, with people who have prior gun arrests and are getting bail at all, or getting bail that they can afford. If you have more than one gun arrest, the propensity of you to be carrying a gun at any given time and using that gun or having a gun used on you, it's higher. And we'd like to see those folks out of harm's way. And if that means that they have to be sitting, in a jail till they go to court, so be it. But we're trying to get our arms around all the numbers and try to move forward together as the city, the police department, the courts, and the DA.
Right. Thank you.
Thanks, Jack. We're going to go to Pat Loeb of KYW.
Brian's on the call. I think this would be for him, but Senator Toomey put out an analysis that said Philadelphia got $276 million in the CARES Act to date, and there's $116 million still unspent. Is that money earmarked for anything, or can you respond to?
I'm not aware exactly the number that's unspent, but we can get back to you. The $276 million in CARES is tied to certain requirements of how it's spent, and there's always been we have to spend it down based on certain criteria, and there may be stuff in the pipeline that's not been approved yet or has not been accounted for, but we'll get back to you and find out. The bottom line is that we went from having a major, one of the best fund balances we've ever had as a city, money in a rainy day fund, money in a fund for our labor contracts, and money in a fund for a downturn in the economy. And in 2 months or so, we went into a $750 million hole. So even though it's $276 million, whatever's unspent is unspent, it still doesn't make up for the $750 million. And that's why we're looking for further assistance without strings attached. And Senator Toomey could be really helpful in that if he wants to give us some of the flexibility we need to replace revenue that we've lost. So we'll get you full accounting, but if the implication is that somehow we've gotten enough or more than we needed, that's totally false.
Thank you, Mayor.
All right, we're going to go to Kennedy Rose of the Philadelphia Business Journal. And if anyone else has additional questions, please raise your hand now.
Hi, my question's for Dr. Farley. I was wondering, what's the declining number of cases and the declining % positive rate mean for the possibility of indoor dining on September 1st? And if the numbers continue to decline at the current rate, would that put the city in a position to give that green light next month?
Well, one thing I've learned to do is to not predict what's going to happen because the virus is full of surprises. I'll simply say what we said is that indoor dining cannot start before September 1st. It might start on September 1st if the numbers continue to look good. But there's still a little bit of time before September 1st to find out whether the numbers will continue to look good.
Okay. And in terms of the numbers looking good, what would be your ideal threshold for, I know you say all the time that there's a variety of numbers, but what would be the threshold that we'd have to meet to get there?
Well, we have metrics that we've laid out for going to green on our website. And we laid out there, we want the daily case counts to be below 80 per day or the percent positive below 4%. And we want to see a steady decline for at least 4 weeks. And there are other metrics there as well, most of which we've already met.
Okay. Thanks so much.
Thanks, Kennedy. We're going to go to Alan Yu of WHYY. Alan?
Hello, can you all hear me?
Yes.
Okay. Is there any plans to incorporate antigen tests? I guess either antigen or rapid antigen tests into Philadelphia testing sites. Is that something that the city is looking at?
So for those people who don't know, there are rapid tests that are done that are a different sort of technology. The main tests I'm talking about here are called PCR technology. Antigen tests have the advantage that they can be done very quickly. So you can get a response right away, and they're not dependent on complicated chemicals that need to go to a separate laboratory. The downside is that most antigen tests that I've seen have a major problem with false negatives. Maybe as many as 30% could be false negatives. And there may even be false positives, as you know, with the governor of Ohio. And so any testing site that wants to can try to procure these machines in order to do this antigen test. And so there probably will be more of them doing that. We are not actively promoting it right now at the city level right now because of our concerns about the accuracy of the test. If there's an antigen test that comes out in the future where there's evidence that they're much more accurate, then we'll be much more enthusiastic about promoting them.
Alan, did you have any other questions?
No, that is all. Thank you.
Okay. We'll go now to Chad Cordelli with 6 ABC.
So the Governor Wolf issued his guidance on the schools, and it says any county with substantial transmission must do all virtual. And then the Department of Health's website says Philadelphia has moderate transmission, yet the city's website says they have high transmission. Which are you guys going?
Yeah, we fall, and according to the governor's criteria, we fall in that middle category where the governor is recommending either blended instruction, which would include some in class and some virtual, or all virtual. It's our position that schools still can open in Philadelphia safely with a variety of safety measures, and so the blended option is something that they can choose to do. The public school system, School District of Philadelphia, has opted to go all virtual to start, and other school systems in the city are still working out what they'll do. But we feel that it can be done, and it can be done also within the governor's guidelines.
I think he's off.
Chad, did you have any other questions?
He's muted.
Unmute. I apologize, guys. My thing just kicked me off, so I didn't hear any of that. But that's fine. I'll go back to the video and hear your answer. But Mayor, you were talking about the finances in the city. I was wondering, obviously this is dragging out longer than many people would expect. If this continues has the financial impact changed? If this continues for 4, 5, 6 months, and if so, how devastating is it going to be? Is it going to be for city services? Because we hear so much about the trash, certain parks.
The trash issue is not a financial issue. It's a manpower issue. It's a personnel issue. We've had 100 or so city workers that were affected by COVID or tested one way positive or had to be quarantined. You see cities around the country having the same difficulty. I mean, our trash folks, our sanitation people work in 12 hours a day, sometimes 6-7 days a week for months now, and they were exhausted. And we're also, as you know, 25% more trash generated because people were staying home and generating more trash. So we're back up to speed as of today. I think we had 184, 185 crews on. So it seems that things are starting to kind of shake out, and we're getting back on schedule. As far as this continuing for the next 4, 5, 6, 7 months, yeah, it's going to have an impact on the budget, and we're going to have to, in the next budget round, find out where we are, project where we may be, and take those. I mean, unlike the federal government, we can't run a deficit, and we have to live within our means, have a balanced budget and a balanced 5-year plan, and hopefully we won't have to suffer that pain. And some of our tax numbers are hanging in there or exceeding what we thought they would be after the last 6, 7 months. So we'll have to take a wait and see attitude. And again, we can't spend money we don't have. And that's why we really need the flexibility on the CARES money maybe coming from Washington.
Can residents expect more services to be curtailed? I mean, just to be impacted, like, will they see more services? Maybe,
I mean, we've had difficulties with our libraries, obviously, because our staff folks are concerned about their own health. We've had issues in the police and fire department, but they're soldiering through. And I keep on looking at the private sector and nonprofit sector, nurses, doctors, and hospital personnel, and they're fearless. I mean, they're unbelievable. So I mean, I think what people are experiencing from some services that are less services than they're used to has more to do with personnel issues than it does do with money at this point. But if we get to the money crunch and it continues, then we'll have to adjust and do the best we can with what we're dealt.
Thank you.
Thank you.
Thanks, Chad. We're going to go back to Martin Pratt of Philly YBN.
Yes, this is a question for also the mayor. When it comes to the gun violence issues that we've had, and maybe it's for the director, the deputy director, I know last year there were grantees that received money from the Office of Violence Prevention. Have any of those grantees been activated in this latest continuing fight against gun violence? And if so, how would the community find out about the grantees that have received money from the city to help prevent gun violence?
I think it was $1 million in the first round and $1 million slated for the second round. Vanessa could give you more details as to what was spent, who got what, and where we're going.
Yes, we gave out 2 rounds of targeted community investment grants, we call them. In the first round, we gave to about 47, 48 people. The second round, we were able to give to approximately 52 or 53 people. Now, the pandemic caused some of the programming that had gotten started to be put on hold because, as you can imagine, many of these programs really involve the face-to-face interaction, whether it be with youth or with offenders or others to enact the service. We are just recently begun to continue to work with the community providers who have been awarded the grants to come up with more creative ways to figure out how we might be able to deliver some of these same services, whether it be virtually or in some other way that would be in line with the public health guidelines and the social distancing requirements. So some of those grants have been suspended. However, the funding is still there, and we're working with them to get back on hold. We, in terms of the gun violence epidemic that we're experiencing and the increases that we're seeing right now, we definitely stay in touch with our community partners. Many of them are folks who've received these targeted community grants, and we're doing everything that we can think of to work with them and to work with the community in terms of how we are actually going to address this gun violence. And when I talked about that GVI program a little bit earlier, the Group Violence Intervention Program, one important component of that team is members of the community. So it would be either a community influencer, or what's turned out to be a very important component is that there is a person from the community who is a member of the team who has actually lost one of their children to gun violence. And that's very impactful as we go out and talk to people about the impact that this violence is having on individuals, on families, and on the communities in general, in terms of how traumatized folks are. So we are definitely continuing to stay in contact with our community partners and trying to bridge together on what we can do to address the violence.
Thank you.
Great. That concludes all of the questions for today. We will see everyone back here at 1 p.m. on Thursday for our next briefing. Thank you.
Thank you.